Good morning. It's Friday. Today's show is brought to you by Rosenberg's and Visit Tillamook Coast. In the studio, I have Adventist Health Tillamook gentlemen. We have Mike Glemser and Eric Swanson. Good morning.
Hey, good morning. How are you, Lisa?
Good.
Good morning, Lisa.
Good morning. Mike, you're a new face. Eric was in here last month, so we can just ignore him for a minute. We all know who Eric Swanson is. But you're a new face. Do you want to tell us who you are and what you do at Adventist Health?
Sure. I'm glad to be here. Yeah, I work with Eric a lot. And
sorry for that.
Love
Other duties as assigned.
Yeah. We're sorry. Our condolences. One of those jobs, other duties as assigned?
Yes.
That's always fun.
I actually manage recruiting for Adventist Health in Oregon, which includes Tillamook. So.
And also, as you were telling me before we started this, Hawaii.
And Hawaii.
Hawaii. That's kind of cool.
Yeah.
Yeah. Very different climates there. Very drastically different.
Yes. A little bit colder here. But I'm glad to be here. I'm an Oregon resident. I've been in Oregon for 10 years. Mm-hmm. So really love Adventist Health and what we're doing out here. So.
Awesome. Yeah. So we're going to talk recruiting today and the positions that are open at Adventist Health Tillamook and kind of the different levels and... Eric, do you want to introduce yourself? Sorry.
Sure. I'm Eric. I'm the president at Adventist Health Tillamook.
You're just sitting there staring at me. I'll give you your chance. Sorry that we're ragging on you today.
It's totally fine.
Okay. Anyway, there are, with this is a nationwide trend, but plenty of positions open at Adventist Health Tillamook in varying levels of skills and requirements and certificates and things like that. Where do you want to even start this conversation?
Well, let's start with how many positions we have open.
Okay.
And then we can get into the some of the details about the positions, how people apply for positions, how we train them, that sort of thing. Adventist Health Tillamook has about 600 employees total. And as of today,
we have...
Yeah, we do. We have a lot of employees. And we have about 70 open positions right now.
Wow.
So that's a lot. That's, 12% of our workforce jobs are open. And like you mentioned, they are across the entire spectrum. And let's start with entry-level positions. If you want to start a career in healthcare, now's the time. We have a lot of entry-level positions that in years past, pre-pandemic, we had positions where we required them to have training, certification, those sorts of things before they walked in the door.
Before they came.
I'll just give you 3 positions that are top on my list for walk in the door and we'll train you and you can go to work. One of them is a phlebotomist. Sometimes we call them lab assistants, but phlebotomists draw blood. They do point of care testing in our clinics, which means they run simple lab tests in a lab in a clinic. And then some of them work inside the laboratory, processing specimens, assisting the MLTs and the med techs with processing specimens. They prep the specimens so the tech can run it and get the result. But to be a phlebotomist, Tillamook Bay Community College does an amazing job with the phlebotomy course. But you're not required to walk in the door with any certification. And we can train you on the job to become a competent phlebotomist. And again, all the jobs that we're going to talk about today are living wage jobs. We have an amazing benefit package that goes with them. It is exceptional benefit package, especially when it comes to healthcare, the way it should be, being a hospital system, right?
Right, sure.
But phlebotomy is one of those where you can walk right in the door and we will train you. The main thing is if you want a career in healthcare, you've got to be somebody that wants to care for people. You're there. It's a helping profession. And the people that are most successful have their eye on the ball, which is I'm here to help people. So phlebotomy is one of those positions. And Mike, how many of those we have a number of positions open, don't we, for phlebotomy?
We do. Different shifts, different length of shift as well. So there's even per diem opportunities. In our speak, we call per diem, but that's kind of an on-call role.
Oh, gotcha.
So we have those available too.
And per diem positions we find are excellent for people who are going to school.
Oh,
so
sure.
maybe you're going to school to get a degree in you pick the degree. A per diem position allows you to tell your supervisors before the month, say, hey, for the month of October, I'm available these days.
Ah, yeah,
And then
sure.
they will plug you in
Yep.
where it fits for your schedule and the gaps
need.
that we have in our schedule. So per diem is a great thing for students. I used to be a per diem employee. Twice in my life, I've been a per diem employee for Adventist Health. Once when I was in college, I was a per diem employee, so I'd fly home from Texas, and I'd provide Norma Rankin my schedule in advance and say, hey, I'm going to be home for spring break, Christmas break,
Right.
summer.
Sure.
Here's the days I'm available. Plug me in on the schedule. And I'd come home and work.
That's cool.
And as an EMT. So it was great. The other job that we have that's really, it's really great that you don't have to be certified is a medical assistant. So a medical assistant works in the clinic setting and is the doctor's, quote, nurse.
Yeah.
They're now medical assistants.
He was doing air quotes with that.
Yes, I was. It's a living wage job with opportunities for advancement and growth. And we can hire you with no experience and train you on the job. And after 2 years, you're eligible to become a certified medical assistant.
Oh, really?
Which means you have to sit for a test.
Sure.
Jump through the hoops, complete the licensure requirements. And once you become a certified medical assistant, then that goes into another higher pay grade. And if you look at our organization right now, we have Twyla Plummer, who's our director of operations for the clinics on the west side of the Coast Range. So she's responsible for 6 different clinics. Twyla started as a medical assistant.
Oh, that's cool.
And became a certified medical assistant, moved into a lead medical assistant role, became a practice administrator, and now she's director of operations running 10 clinics or 6 clinics.
Yeah.
So she's like, when I look at Twyla, I see the ultimate
sure.
medical assistant.
Right.
So there is a career path for people who want to be in those clinic type of roles. So again, a great job that's living wage that you can walk in the door with no training, and we will train you for that career.
And I'll jump in on this, Eric. This is really a very unique opportunity for people in the community to be, if they're interested in healthcare careers. Eric mentioned it's a great time because we're one of the few organizations that actually does what Eric just described. MA, typically medical assistant, has been a hard position to. There's a barrier of entry that you have to go to school and you have to become certified. This is just a wonderful opportunity. We've been able to help quite a few people, even this year alone, move into a role they probably had never, and many of them never really knew existed. And so it is really a great opportunity right now, both in phlebotomy and medical assisting and nursing assisting in the hospital as well. We train for that also. So it's really a great time for people to get into healthcare.
I'm actually looking it's the Adventist Health Careers page. You have to type in Tillamook, and then you can see a lot of these jobs that we're talking about.
Yes.
I also see like an urgent care tech. Is that also, do you need certificate for that?
So urgent care techs can either be medical assistants, but what we really lean towards are emergency medical technicians. If you're an EMT basic and or an intermediate or a paramedic even, and you want to be in a career like as an urgent care tech, most of our urgent care techs are emergency medical technicians. And they do clearly a little bit more complex work than the most standard medical assistants do.
Right.
It's a little faster paced.
Sure.
And you see some really sick people walking in the door to urgent care. So that's what we're really recruiting for there.
Cool.
And right now, if my memory is correct, we have 3 medical assistants who started with us as medical assistants who are currently in the nursing program at Oregon Coast Community College.
Oh, cool.
So again, another step in career progression.
Yep.
They got into being a medical assistant and said, I want to be an RN, and have made it into the program. So again, excellent opportunity for growth.
Yeah. I, in my 18-year-old brain, thought that I was going to be a medical. I was like, yeah, I love working with people. And I took like medical terminology, which was very fascinating to me, like how the words are broken out into different Latin meanings, and like ology means the study of. And then I got to the class where I found out that you had to take blood and use needles. And I was like, I'm out. Can't do it. Not the career for me. Cannot do it.
So yes, medical assistants draw blood. So they do they cross over into the phlebotomy world. Some of them are trained and credentialed, I'll call it, to start IVs so that a patient could get an IV infusion, especially in urgent care. So those skill sets are a requirement. And again, we'll teach you to do those things.
Yeah, cool.
So on your point, though, I'm glad you brought that up, because I would be the same way. And so, but I wanted to be in the medical field, even though, like you, that wasn't my my thing.
That part of it, not interested.
Yeah, but it's there's so many careers in healthcare that aren't like directly giving drawing blood from a patient or something like that. So. I think it's great that people don't even realize that goes on in the hospital. I mean, recruiting, one of them, or, there's positions like when patients come in the door at one of our clinics or at the hospital, they need help getting registered, making sure everything, getting their appointments. So we have schedulers, we have customer service.
I'm glad you're going here, because what I have up on the screen right now is patient access scheduling representative. There's several of those available right now.
Yes, those are great jobs, and we need them right now. Yep.
And so what does that role entail? That's answering the phones and scheduling patients for upcoming appointments, whatever that may be?
Yeah, I bet everyone listening to this radio program has probably at one point or another had to schedule a medical appointment, right? And so that is a position that you really are helping people every day, but you're not, again, drawing blood. Yes, that's exactly you're taking calls, you're scheduling patients, or patients coming in for, say, if you have a surgery scheduled or something like that, and you come into the hospital and you're getting, that first step before you actually go into surgery, things like that. We have those are types of those roles as well. So it's in person and over the phone as well.
And these people, I believe everybody that works in a hospital, regardless of your job, is a caregiver.
Yep.
And let's just think about the patient access scheduling representative. If there's not a scheduler,
how
you can't see a doctor.
How are you going to get care?
That's right.
Yep. Or you can't go and get a CT scan. It's everybody works to make sure the patient gets care. And that's why I think they're all caregivers.
Yeah. So where would somebody go? So I Googled Adventist Health Tillamook, and actually in Google, it showed me the website, and then underneath it said like career opportunities. And then when I clicked that, it took me to the main Adventist Health website. Is that kind of where people have to go?
Yes, because it doesn't the best way to do it.
Yeah, it doesn't look like there's like a direct link.
You could type it into the top of your browser. You could put in adventisthealth.org/careers.
Yeah.
Or you could Google it. The nice thing, we're a large employer, the largest healthcare employer, right, in the county. So we can definitely, you'll find those positions Googling like that. Adventist Health patient, you could do scheduler, it'll come up.
Yep.
All of our jobs are on Indeed as well, so you can see them there. That's probably the best way to do it. But I can even, if people would just like to, they want a phone number, they want somebody to call, they want to even text us. You can text us. And that is, there's a recruiter that is full-time here in Tillamook. His name is Joe. Joe Penna is his name. And Joe would love to talk to anybody that's interested in a healthcare career. So I can give the phone number.
Sure, go ahead.
You want it at this point?
Yeah.
Okay.
And we'll repeat it again at the end.
Okay, perfect. So feel free to text or call 503-893-5502. So I'll repeat it one more time. 503-893-5502. Go ahead and text your job interest and send a resume.
Yeah, or I want to get in healthcare, but I don't know where to start, or I don't, this is what my end goal is. How can I get in my foot in the door type of thing?
We are happy to talk to anybody that's interested in that.
How to make your goals a reality.
Yes.
Your dreams come true.
Absolutely.
So another way that we help your dreams come true.
Yes, tell me.
Is that we actually...
Such great segues, Eric.
Yes,
love it.
It's beautiful. We actually have programs where we'll help pay your college tuition.
Oh, I love that.
So, for example, I'm not going to name names, but we have an EMT basic who's going to paramedic school right now. So once this individual completes paramedic school, we're going to pay for paramedic school, basically. We help pay classes for nursing. We help pay for your classes if you want to get advanced phlebotomy certificate. So we want people to learn and grow every day at work.
Yeah. Yep.
And we also want to grow our own. We want local people working in our hospital because I just think it's much better when you walk in the door that you see a face you know.
Right.
I'll just give you an example of how that commitment comes to life with my executive team. If you look at the 6 people on my executive team, we have been serving at Tillamook in that hospital for 111 years.
That's cool.
That's amazing. I shared that with some executives from Tuolity Hospital, or OHSU Hillsborough now.
Over the hill.
And they were like dumbfounded. They said, what do we got for our executive team? Like 10 years?
Like total combined.
Total.
Yeah.
And because it's not uncommon for executimes to want to climb the corporate ladder and
well, and
move
when you're
around.
out there too, there's when you're over the hill, there's so many other hospitals around that are easy. They're within driving distance, easy driving distance.
And where our executive team is committed to this organization.
This community.
In this community. And we all started out in this community
I love that.
at this hospital in different roles. And we are now executive leadership. And we love this hospital. And I don't think any of us are going anywhere. And that's what we want too. We want you to come into the door of our hospital and start out as a phlebotomist, start out as a medical assistant, and grow and reach your maximum potential right here in Tillamook.
I think that's really cool.
Yeah.
I'm going to take this opportunity to read my commercials, if you don't mind.
Go ahead.
Okay. Stop by Rosenberg's, your one stop for everything you need to build, remodel, renovate, spruce up, redecorate, freshen up, and just plain maintain your biggest asset, your home. Is it time for new carpet, vinyl, hardwood floor, tile, or laminate? Stop by Rosenberg's and let them walk you through the process to get it to completion. Blinds, they do those too. From measuring to installation, they can get it done. The friendly place to be, where they make your vision come to a reality. If your idea is more on the outside, they've got you covered there too. They have a great selection of electric-powered blowers, trimmers, lawnmowers, and chainsaws from Steel, Husqvarna, and Milwaukee to break you free from gasoline. No more worrying about the gas getting old or mixing it correctly. Just charge it up and go. And if you haven't made the jump to electric yet, or you just like the power and runtime of a gas model, they've got those too. Is your power equipment not running up to snuff? They have a full-time mechanic to tune and dial in your gas-powered equipment to make it purr like a kitten. Build it, plumb it, wire it, paint it. Rosenberg Builder Supply, Tillamook. And the award-winning North Coast Food Trail, a program of Tillamook Coast Visitors Association, celebrates the farmers, fishers, chefs, farmers markets, and food experiences of Oregon's North Coast. From Astoria to Nescoin, you'll find fresh seafood, local produce, locally sourced menus, craft beverages, foraging experiences, and cooking classes. Sunset Magazine called the North Coast Food Trail the best food trip in the West. Find your next delicious meal and download the brochure at northcoastfoodtrail.com or find videos at youtube.com/Tillamook Coast. I'm talking with Adventist Health Tillamook this morning. I have Mike Glemser and Eric Swanson here. So we've been talking about positions that are open that don't necessarily require a certificate or anything like that to apply. But of course, you also have higher level positions open, nurses. Do you have physician positions? Physician position? That's kind of fun to say.
Yes, we do
Positions
have some.
opens?
We're recruiting for a handful of physicians, PAs, family nurse practitioners. That's not Mike's responsibility. We have a physician recruiter that does that work.
Because I imagine that's an out of town recruitment, I would think, right?
Yeah, you have to have experience for that
Right,
job.
yeah.
We can't train you to be a doctor on the job.
I would feel like the pool here is probably very limited.
Yes, it is.
Yeah.
And so we have a recruiter who works full-time for us and our hospital in Portland, recruiting physicians, PAs, family nurse practitioners, and LCSWs. Those are all positions that we have open. And we also have engaged a couple of nationwide recruiting firms trying to find the right fit for providers to come into our community.
Sure.
And it's difficult right now. We're lucky that we don't have that many openings. We only have a handful. But it's difficult recruiting providers these days.
Yeah. Well, I imagine, I mean, I know the employment market, this is a conversation that a lot of employers are having TEP was just in here this week and she was saying, yeah, we've had this bookkeeper position, accounting position open for a long time and they're hiring for one. But then so there's that issue already of like hard to recruit employees for whatever purposes. But then we have a housing issue that then compounds that. And we see that with a lot of employers, the school district, the creamery, the county, and this has been going on, I feel like even pre-COVID, where you would hear a story of a teacher was supposed to start at the school district and they couldn't start because they couldn't find a place to live. How is the hospital helping to combat that, or how are you guys handling that?
Well, it's very difficult. We have folks that try to move into our community. For example, we had recruited a physical therapist from Alaska, and they were going to move here, like the job, like the organization, like the location, and at the 11th hour had to pull their
see, there's that exactly
I don't
that
have
story.
a house.
Yeah.
And so some of the things that we do, we try and work closely with some of the real estate brokers to keep to let us know when there's properties available. I had a individual in Tillamook County just last weekend send me a text message. Hey, I have a friend that has a property, might be great for somebody, a healthcare worker. Let me know if you're interested. We also rent apartments. We have a number of apartments that we rent to get people temporary housing.
Sure.
Or when we have contract labor, like right now, because we're trying to recruit RNs, we've got a number of part-time or contract labor RNs who are working here, and we will sometimes put them in those apartments. And but it's very difficult. And so I feel the pain of everybody, all other employers who are in the same boat we are, that it's just super difficult to find a place for them to live.
So I love that you just said that about, and I can't remember who was talking about this. It might have been TJ at the county, he's the housing coordinator, but saying that if you have an extra room or a basement, daylight basement area that you might consider renting it out or something like that, to let him know, because he knows of folks and employers that are looking for temporary housing for employees, but to consider those things on your own property, like you said your friend called and said they had a friend that said, hey, this might actually, we've got something that might work. That's how we kind of help bridge that gap, even though it's a gigantic gap. But it's small little pieces and parts like that.
Yep, little pieces. And you know how Tillamook is. Word of mouth works.
Yeah, for sure.
You just kind of hear about things. Our human resources office kind of keeps a informal list. If people have a property that might be suitable for somebody short-term or long-term, and they want us to know about it, it's our human resource office that you can call and leave that there. Because Mike may be recruiting somebody, and then they're going to go, what about housing? Well, here's some resources other than just calling a real estate broker or calling a property management firm. Here's some additional. You need to do those two things, but here's an extra pool that you can look into.
Yeah, I see stories a lot I'm in the Tillamook County for Rent Facebook group, and there's always those stories, like the Alaska story where someone's saying, we're moving for a job. Does anybody know of anything available? And I actually just saw something last week where someone was in Pacific City, and in like 48 hours, she had been connected with somebody who had a unit or had a room or something that she could rent temporarily until she found more permanent housing.
Yeah. It's difficult.
Yes, and Eric brought up something I'd like to mention. Tillamook word of mouth really can help from a recruiting perspective as well. So a lot of people in the community that may have relatives or friends across the country or anywhere that they know are interested in moving here. We'd be willing to talk to, any nurse or physician or anybody with healthcare experience that people know.
I'll tell you, my husband's been doing his part because his brother is a oncology physician, but on the East Coast, and he's tried to get him to come out here.
See, that's perfect. That is a perfect example.
House. Yeah.
That is a perfect example. We'll love your help. Yeah. The whole community can recruit.
I assumed, is the rural nature of our community sometimes a barrier.
Yes.
I feel like, because I mean, I lived in a big metro area. I lived in San Diego for 10 years and loved it. It was in my 20s and it was great. And love living here. I don't ever plan to leave, but I do miss the convenience of like a big city. Although I don't want to live in a big city anymore.
Yeah.
But I'm wondering if that's a barrier for people to take a job here, which is why it's nice to grow your own.
That does end up being a barrier. And sometimes it's not the person we're recruiting that it's a barrier for. It's the spouse or significant
or the family.
other.
Yeah.
You know, where they're used to, let's take a physician.
Right.
Who's most physicians get trained in an urban area. So this physician's spouse is used to maybe cultural events or yoga studios and, you know, things that Tillamook doesn't have an abundance of.
Yeah.
And that's where we sometimes, it really gets tricky. Because the let's take the physician scenario. They love the hospital. They love the medical practice. They want to work in a rural area. They want to have connections with their patients outside of just them walking in the door of the clinic. But then we have the other barriers.
Right.
And, you know, when I talk to providers, when I interview them, I remind them that Costco is really only an hour and 10 minutes away, if that's what you need. You know?
You say that. But there is this mindset, because my family all lives in Portland, and it's always funny whenever we go to Thanksgiving or family events, and it's 9:30 at night, 9 o'clock at night, and they're, "You're gonna drive home right now?" I'm like, "Yeah, it's only an hour and a half. Like, it's not," because they're on the east side of Portland. Like, to us, it's not that big, but it is when you're used to only driving 10 minutes to Costco or whatever. Yeah, you do have to plan your life out a little bit, but it's not that far.
We recruited a communications manager, and John lived in Beaverton, and he came down here, and one of the things he asked me is like, "Okay, how do you do your shopping? How do you do this?" And I basically said, I think the Tillamook way is, you plan your trip to Portland. And you get a whole bunch of stuff
done.
Make a list of everything you've got to do before you head home. And he's okay, I can do that.
That's true. Once a month, you make your list. You get into the bank or whatever else you have to do. All the stores.
The stuff you can't do in Tillamook.
Yes,
I would add, though, that the pandemic did change some people's focus on
where I can live and work.
Yes, exactly. So we did see people interested in more rural areas.
So, looking for they got a taste of that like slower pace of life. Not so busy, go all the time.
That was one positive.
Although I think there's been a lot of positives out of the pandemic. I mean, it was not great, but there's been a lot of great stuff out of it.
I did want to mention that I think people would find interesting is healthcare. If you think about worker shortage just in general, but healthcare is... The pandemic sort of exacerbated the problem because we've known for about 10 years that there was this coming cliff of people in that baby boomer generation that were retiring. That a lot of them worked in healthcare. And at the same time, you have that huge retirement. You have an uptick in usage of healthcare. Right. Because that's the same group of people. So if you think about the pendulum, that group of people that's retiring is also using healthcare. So it's like a double. And the pandemic kind of didn't speed it up. We knew it was coming, but it even made it worse. So that's why we're kind of in this situation.
That's a really interesting way to look at it, for sure.
And I think that I just want to remind people that working in healthcare in a rural community is absolutely what I love. And every day I walk through the lobby and I can see people that are my family and friends. And so we're caring for our own. And you don't get that working at a hospital, in Portland.
That's right.
While they provide excellent care, it's completely different. I just told 16 new associates on Monday, we had orientation. And I told them about my experience of being at a large downtown Portland urban hospital having surgery 20 years ago. And it was like I was lined up and I was a number. And we try not to do that. We want you to know that we care about you as a person, as an individual. And I think that's the benefit of working in healthcare in a rural community, because you're taking care of people that you care about. It's a higher calling and it's an honor.
That's cool. We are out of time. Do you want to plug that phone number again for recruiting purposes?
Again, just text or call Joe Penna, 503 503-893-5502. Again, 503-893-5502.
Is there anything else you wanted to mention? It was a good conversation.
Yeah. I appreciate you letting us talk about this. It's really important that we get the right people doing the right jobs.
Yeah.
And recruiting, our talent, you hear this all the time, that your employees, your greatest asset.
Right.
Well, in fact, they are. They are the one. We can have all the fancy machinery in the world, but it's the person who's at the bedside, that's greeting you when you walk in the door of the hospital, that's delivering you your tray of food.
Yep.
That is where the differences make. They are the difference makers.
Very cool.
Well said.